Hello, everyone. Welcome. Thanks a lot for attending to this webinar. As you know, this webinar is called Evolving from Open Data to Artificial Intelligence Challenge for Municipalities. And it's organized within the frame of the urban health cluster that I will explain a little bit after. So I'm going to share my agenda, so the agenda of the session, okay? Sorry, 1 second, I'm going to include the sound. Okay, can you see my screen?
Yeah, but
Yes.
you are not presenting. We are looking.
Yeah.
Okay, now.
Now,
Perfect.
yes. All right. Okay, so the agenda for today is, as I was saying, first of all, I'm going to explain a little bit what's the urban health cluster. Then we will have Alma Virto, a PhD researcher at the Robotics Institute of the University of Valencia, who will introduce us to the European health data space. Then we will have Ricard Martinez, lecturer in constitutional law, researcher at the Robotics Institute of the University of Valencia as well, which will talk about how to design secure data spaces. Then we have a little change in the agenda. We will have first Ernesto Faubel, which is the head, was foreseen for the next slot, but we will have it at 11:30. And he is the head of the Smart City and Data Management Department of the City Council of Valencia. And he will talk about data governance in smart cities and the metaverse. And then after that, we will have now Carlos Alonso Peña, which is the director of the Data Office Department of the National Ministry of Digital Transformation. And he will describe the Spanish National Health Data Space. And finally, we will have Paulo Morgado, which is associate professor at the Institute of Geography and Spatial Planning at the University of Lisbon from Emotional Cities, also another project partner of the cluster, who will do the wrap-up. So we have really outstanding speakers, and we really hope it will be interesting for all of us. So I'm going to, if there are no questions or comments, I'm just starting with my part. So as I was saying, I'm going to talk about the urban health cluster. So I will explain briefly the main objectives of the cluster, the thematics working groups in which it's organized, its main activities, also the research methods used in the cluster or in the projects. And finally, if we have time, I will show a 1-minute video about the cluster. So the urban health cluster. So it's the first cluster of its kind in Europe, and it's a cluster which aims to promote urban health within Europe through the synergies of 6 European projects that have been funded under the same call. These projects are the ones that you can see here. They are Emotional Cities, Enlighten Me, Heart, Resetas Urbanum, and Well-Based, where I come from. I am the coordinator of Well-Based. So the main objectives of the cluster are to increase visibility of urban health research and actions, to strengthen the evidence to inform policies related to health, and finally, to facilitate international cooperation with relevant stakeholders in these fields of urban issues. The cluster has a duration of 4 years, so we will end next year, okay, because it has started in 2021. And as I was saying, we are 6 projects in this cluster, each project with its own consortia. So this means a lot of countries, 26, a lot of cities, 29, and over 6,000 participants recruited for urban programs, for city labs, for taking part in innovative health actions throughout Europe. here you can see in this word cloud some of the concepts, so you can have an overview of the main concepts we are dealing with in the cluster. So you can see well-being, natural environment, planning process, built environment, socioeconomic, cultural conditions, physical health, etc. So the cluster is organized in 6 working groups, which address transversal aspects of health and of the project. So first working group is called Science Translation to Policy. The second one deals with health determinants and urban interventions. Working group 3, in which this webinar is embedded, is called Data Analysis and Protection Digital Platforms. And it deals with all the legal and technical framework needed to access or to make research with data for policies. Working group 4, it's called Urban Issues and Epidemics. Then the working group 5 is about dissemination, communication, and exploitation of the cluster results. And finally, working group 6 is about citizen science, about how to involve citizens in health urban issues. What are the main activities of the cluster? Well, we are organizing thematic workshops. We have done 3 so far related with the work of the working groups. We have our annual meetings. This works actually as a project. We are meeting all together annually to check our project's progress. And then also I take the occasion to say that we are going to organize a public event of the cluster, the final event of the cluster in Brussels at the end of January. So if this is a topic that interests you, you are more than welcome. We also try to contribute as much as possible to events and conferences. I have mentioned here some of them. And also we deliver joint policy briefs. So it is foreseen in the cluster to deliver 3 policy briefs. We have done 2 so far. So the first one was called How Does the Urban Environment Impact on Health and Well-being of People, where we describe the cluster, its aim, and the key health determinants that the projects are addressing. And the second policy brief is called Policy Topics Addressed by the Cluster and Primary Health Determinants Analyzed, so more in depth. And the third one, which will be about the results of the 6 projects and our general policy recommendations as a cluster, will be issued at the beginning of next year. These policy briefs, they are available at the cluster website. You can check them and download them there. Okay, and since this webinar is about data, I wanted to also mention what are the research methods used by the projects in the cluster. So as you know, all these problems, all these challenges that we are facing now in the cities about health require the use of advanced methods and tools to build evidence-based policies. So that's why we need this kind of actions and research. So in the 6 projects of the cluster, they are collecting and monitoring all this kind of data. I just put here all these so you can have an overview of the data that we monitor. And here they are divided by social determinants of health. So starting from the bottom, you can see demographic factors such as sex, gender, age, also lifestyle factors, hours of sleep, drug consumption, about community networks, the attachment to your neighborhood, number of association in your neighborhood, for example. About the built environment, we collect data about outdoor lighting, quality of buildings, indoor environment, lighting, energy efficiency, etc. And also we collect data, general data about the city, about the noise, the air quality, weather, etc. So this is all the data we are dealing with in the cluster. And about the methods used to analyze it or to collect it, or which kind of, through which means we are collecting this data, we have also this list. I'm not going through all of them, but just also, again, so you can have an overview. They are mainly data quantitative, also some qualitative, but mainly quantitative. And they include wearable devices and biosensors, remote sensing, spatial navigation experiments in virtual reality, medical screening of population, households monitoring, etc.